Do you have a shelf in your house somewhere, or maybe more than one, just chocked full of supplements you were told could help with your endometriosis related pain? In this video, I'm breaking down the evidence for endo-specific supplements. I hope by the end of this video, you have a good understanding of what supplements might help you achieve your endo pain reduction objectives. Please like, share, and subscribe for more endo-specific content. So let's talk about what kind of supplements we have research for when it comes to endometriosis related pain. Unless you're somebody with silent endometriosis, you probably have a lot of endo-related pain. Let's talk about some of the supplements or supplement combos we have research for to improve pain symptoms. In this study, researchers invited 60 women ages 15 to 45 to select a group A or B. Group A received 1,000 milligrams of vitamin C and 800 international units of vitamin E, and group B received a placebo containing mannitol and magnesium stearate. Post-treatment pain with periods, pain with intercourse, and chronic pelvic pain significantly decreased in group A. That was the treatment group receiving the vitamin C and E. Group B, the placebo group, also reported a reduction in pain with periods, pain with intercourse, but chronic pelvic pain was reported to actually increase in the placebo group in this study. When compared against one another, there was a significantly higher difference observed in group A, which again was the group receiving the 1,000 milligrams of vitamin C and 800 international units of vitamin E. Speaking of both a vitamin C and E combo and pain with intercourse and pelvic pain, a second study showed similar findings. Chronic everyday pain reduced by 43% in those taking the vitamin C and vitamin E combo. Pain with intercourse decreased by 37%. The placebo group in this study observed no changes. This review included helpful information for those who have opted for birth control to help improve quality of life and pain symptoms with endometriosis. It showed that combo birth control plus 100 milligrams of vitamin E was shown to also have favorable effects on pelvic pain. For my fellow endo friends on birth control, this might be a helpful addition to add if you're still experiencing pain while on the combo pill. And just as a little side note, I personally like to recommend a mixed tocopherol form of vitamin E. It's just much more potent when it comes to its inflammation fighting capacity. While vitamin D supplementation from 50,000 international units weekly to every 2 weeks also seemed to improve pelvic pain, the results were not statistically significant. I have long been educating on the importance of gut health for endo symptom management, but are there any GI specific supplements shown to help with pelvic pain? Yes. Lactobacillus gasseri has protective effects against endometriosis by blocking inflammation. This probiotic strain has been shown to help reduce pain with menstruation, and it has been studied specifically in the endometriosis population. While not specifically in endometriosis patients, this promising study showed that 30 milligrams 1 to 3 times daily of a zinc supplement 5 or more days leading into your period can improve PMS symptoms and menstruation related pain. In general, endometriosis patients are more likely to have zinc deficiency, and because zinc is such a potent antioxidant mineral, it is important to have adequate amounts. We have limited research about magnesium and endometriosis, but in this study, magnesium was shown to reduce pain in 21 out of 25 participants after 6 months of use via reduction of prostaglandins, an inflammatory chemical implicated in inflammation and pain associated with endo. So not a big study, but it does show some profound effects. And if you've been following along on my other platforms for some time, you know that I love me my magnesium. Inflammatory cytokines, which are small proteins that are crucial in controlling the growth and activity of other immune system cells and blood cells, tend to be upregulated in endometriosis patients, meaning we make more of them. Fewer inflammatory cytokines are observed with adequate omega-3 intake or supplementation. This specific study showed improvements in pain ranking after supplementing with omega-3s. A second study in humans showed a 50% drop in pain scores with supplementation of omega-3s. My personal recommendation when it comes to omega-3s is to supplement with a blend that has a higher amount of EPA to DHA essential fatty acids, and to aim somewhere between 1.5 and 3 grams of total omega-3s. This dosage is the ideal dosage for somebody with a chronic inflammatory condition. Several studies have produced promising results regarding NAC supplementation. So NAC stands for N-acetylcysteine. NAC has also shown promise for pelvic pain and even reduction in endometrioma size. 75 of the patients in this study also had a spontaneous pregnancy with 6 months of starting NAC. The researchers in this particular study used 600 milligrams of NAC 3 times daily, and in a more recent study, the researchers used 1600 milligrams 3 times per day for 3 consecutive days and then none for the rest of the week. NAC has also been studied in combination with other natural ingredients, including alpha-lipoic acid and bromelain. In this study, including 398 patients, a combination of 600 milligrams of NAC, 200 milligrams of alpha-lipoic acid, and 35 milligrams of bromelain helped reduce endometriosis-associated pelvic pain and the need for pain-relieving medications. In a study including 32 patients, 30 milligrams of pycnogenol was provided twice a day for 48 weeks. While patients with smaller endometriomas responded better than those with larger endometriomas, there was a profound reduction in symptoms observed, specifically pain symptoms, and the CA-125 lab also declined as well. CA-125 is a common lab marker that is used in sort of the cancer oncology space, but in women who have endometriosis of a deep infiltrating nature or who have large endometriomas, it's very common to see an elevated CA-125, indicating that there's quite a bit of inflammation or that there is a large endometrioma present. Having CA-125 come down in the blood work is a reason to strongly consider pycnogenol supplementation or NAC supplementation. A collection of studies not necessarily specific to endometriosis patients, but presenting applicable findings showed that anywhere between 50 milligrams twice a day to 500 milligrams 3 times a day of ginger helped reduce menstrual-related pain. Ginger is also a well-studied natural ingredient for things like nausea and gastric emptying, especially if you are somebody who experiences a lot of GI symptoms. Melatonin, a neurotransmitter-like substance, was also shown to reduce pelvic pain, pain with menstruation, bladder pain, and discomfort and pain with passing stools. 10 milligrams of melatonin was shown to reduce daily pain by almost 40% and pain with menstruation by 38%. Melatonin was also shown to improve sleep quality and reduce reliance on pain-relieving medications by 80%. So to summarize, we have some pretty promising research for several effective natural pain or discomfort relieving ingredients, including a combination of 1,000 milligrams of vitamin C and 800 international units of vitamin D, 50,000 international units of vitamin D every 2 weeks, although caution with high-dose vitamin D because it can pull calcium out of your bone and affect magnesium absorption. Lactobacillus gasseri was another one we discussed, 30 or more milligrams of zinc, magnesium, 1.5 to 3 grams of omega-3s. Remember that tip on high EPA to DHEA options. 1,800 milligrams of NAC, or a combo of 600 milligrams of NAC with 200 milligrams of alpha-lipoic acid and 35 milligrams of bromelain, 60 milligrams of pycnogenol daily, and 10 milligrams of melatonin. I'll link some of my favorite brands below. A lot of the research in today's video did inspire the EndoFlare Care Relief Blend. So in this blend, you will find zinc, vitamin C, vitamin E, NAC, bromelain, alpha-lipoic acid, pycnogenol, and ginger. So if you're keen on checking this out, I'll link it in the description below. If you enjoyed today's video, please like, share, and subscribe, and I will see you in the next one.